All right, we are going to get down to Medicare 101. Let me set up the screen share here. All right. This recording is going. All right, we're good. So this is my Medicare 101 resource recording. New for 2023. Some of the numbers, if you're listening in a year that is further down the road, these numbers will change every year. So here we go. You're going to go to Medicare section of my website, lowcostcahealth.com. See up here. I'm going to click on Medicare Insurance Resources. I'm going to update these videos with this one, but here's my 2023 Medicare 101 brochure. So this is a quad fold brochure. Kind of looks like this when I have the printed copy. You're going to see this page out first. This is going to tell you when and how you can enroll in Medicare. Some basics about low-income assistance plans that might be available for certain members. But what we're going to focus on today is this Medicare 101 section. So let me blow it up so it's a little easier to read. So here we go. Step 1, got to enroll in Medicare. So original Medicare provided by the government. The government's not going to ask you questions about what supplement or drug plan or anything that you need. You just need to enroll in Medicare. I really don't like the nomenclature, Part A, Part B, because A and B didn't mean anything to us in kindergarten other than they're an alphabet and doesn't mean much to us now. So translate. A equals inpatient or B equals outpatient, because we kind of know what an inpatient and outpatient is, right? You're in the hospital, admitted, you're staying, got the bracelet, or you're an outpatient. Emergency room of the hospital, you're still an outpatient. It's not until they say, okay, we're going to admit you and keep you here, then you're an inpatient. So think of it like in and out, like the burger joint, instead of A and B. We'll clarify a lot. So inpatient coverage under A covers you when you're in the hospital, admitted. Also has some coverage for skilled nursing if you've been in the hospital 3 consecutive days, 24-hour periods, and you're not sick enough to be in the hospital anymore, not well enough to go home. There's some coverage there. So if you go into the hospital, if your hospital stay is less than 60 days, you're going to pay $1,600. Don't panic. We're going to get you help in the private world to help cover that. If you're still alive in there on day 61, $400 a day. That's what they're going to charge you. Still alive on day 91, price jumps up to $800 a day. And again, here's that 3-day requirement as inpatient in order to get coverage for skilled nursing. This is not meant for I'm just going to be put somewhere. You have to actually be getting some kind of therapy, rehabilitation type of thing. There has to be an expectation that you're getting better in order for Medicare to cover that. All right, Part B, outpatient. Doctors, labs, x-rays, MRIs, the emergency room. A lot of surgeries now are done as an outpatient. You go to a surgery center, kind of looks like a hospital. You have something done, you go home. Same day, outpatient. So here you have a $226 calendar year deductible. Calendar year. Did your coverage start in December? You have a $226 deductible for December. January, there'll be a whole new deductible. So When you start isn't the relevant feature on this one. It's calendar year, January through December. This is going to be the first $226 of whatever it is you use as an outpatient. After that, Medicare is going to adjust the bills down to their allowed amount, and Medicare is going to pay 80%. You're going to pay 20%. There's no cap on the 20%. 20% of a few office visits, no big deal. We could handle that. 20% of chemotherapy, a big outpatient surgery, lots of physical therapy or mental health benefits. That would not be pretty. So again, we buy a supplement or another product to help us with that. Right now in 2023, the standard cost for Medicare, yes, cost, not free, is $164.90. This changes a little bit each year. It actually went down from what it was last year. And when it does make a change, it's not a very big jump. So that's the standard premium. But you know, the government, they like to penalize successful people. Got to flatten that bell curve. So you can look at this chart below, whether you are a single individual filing your taxes single, or you are married filing joint, or worst category, married filing separate. You can see what your income was in 2021, because right now that's the last fully filed tax year. That's the one they're looking at. And see that if you were 97,000 or below, you're getting the standard premium as a single person. $194,000 and below as a married filing joint couple. Again, same standard premium. But as you creep up in income, the price of your Medicare creeps up as well. If you had a one-time event, like you sold a house, you sold a business, you sold an asset where you got a big capital gain, don't panic, because the next year in 2024, they'll be looking at the 2022 taxes. So those kind of things do fall off after a while. But if you are continuing to earn money, you're still working past age 65, you have a lot of dividends or investment income or business that's generating that for you, well, welcome to success. And we're going to charge you from the government a little bit more. So now you're the Great Wall of China between the government and what we can do in the private world. I like to tell people that I'm working with that there are two totally different planets. Think of, I don't know, what's the one closest to the sun? Mars. And then you got like Pluto, like way out there, if it's even still a planet. So planet number one, we're going to talk about this center panel. And planet number two, we're going to talk about this end panel. Hopefully it'll be painfully apparent which planet you'd like to go live on. But it's important for you to know the difference. People use a lot of words interchangeably, and that's how they get in trouble, if they say one thing, when in reality, what somebody heard was a different thing than what they intended. So, world number one, I let Medicare do its thing. And all these highlighted holes that are in Medicare are listed here in this benefits column. I'd love to write holes in Medicare, but I think I'd get in trouble. So translate this section of, these are the holes in Medicare that aren't covered that you would have to pay for. So if we have all of our supplements, which are just a single alphabet name, the government's not super original in their naming. Right now in someone turning 65 in 2023, the highest plan you can buy is this plan G. The plan F is still out there. You might have friends that have it. If you went to Medicare prior to 2020, it is an option that you can still purchase, but you may want to let that go when you see the price differential between the two, because F and G are completely the same all the way down the line, except for this Part B deductible.
That's an O, not a zero.
All right, thanks. Yeah, you can tell it's live, right? In the office. All right. So plan G is your top of the line plan. The only thing you'd be responsible for this, I go over, Part B deductible. Oh, that's that $226. If that's all my responsibility is for the calendar year, good with that. in my part of the world, in California, Santa Cruz, turning 65 right now in 2023. Our lowest cost carrier is like $111 for that a month. The price is going to determine not by how sick you are, it's going to be determined by what age you are and where you live, zip code wise. When you are new to Medicare, you're just getting that spanky new red, white, and blue card for the first time, then in California, the world's your oyster. You have that 3 months before you turn 65, the month you turn 65, and the 3 months after that to be able to sign up for one of these plans. It'll be effective when your Medicare is effective or the first of the month after you actually enroll in it. So if your Medicare date is July 1st and you enroll in July, your effective date for your supplemental policies and drug plan will be August 1st. If you signed up in March or April when you got your Medicare card, the effective date will be July 1st when your Medicare actually starts. So the Medicare supplement, that's the top of the line. There's also a high deductible version of that plan, which is popular with my clients who are in denial about ever needing healthcare. They don't want to spend much money on an actual policy, but the whole thought of 20% of forever kind of scares them. This high deductible plan G has a $2,700 deductible. So we let Medicare do its thing, and ouch, I had to pay $1,600, or I had to pay this $226 and some 20%. Sort of like buying a white horse to ride in and save you if your costs go over $2,700 in that calendar year. So that's something $40 a month in my area. Again, prices will vary by your age and zip code you live in. Just to give you an idea, though, at age 65, what I look at. All right, so that's world number one. I let Medicare do its thing. I buy the financial equivalent of a pooper scooper, and it picks up these extra pieces. And I'm going to buy a prescription plan that covers my drugs that I might get at a pharmacy. So drugs I got in the hospital are covered under this inpatient Part A and my supplement. Drugs I get in a medical clinic like chemotherapy or vaccines will be covered under the Part B outpatient and my supplement. But drugs I go to the pharmacy and get administered to myself, I'm going to need some prescription coverage for that. Here in California right now, we have 27 of them. Got a whole software program that helps me pick the right one for you based on the medications you actually take. So in this supplement world, why would you want to live in this world? Freedom of choice. You can go to any doctor in the United States that is accepting Medicare and is accepting new patients. That second one is the harder hill to climb. We have a real doctor shortage. So that's anywhere in the United States, right? I don't have to worry about a list of doctors. Doctor, do you take Medicare? Yes, great. I have Medicare and a supplement. I'd like to come see you. Are you accepting new patients? Yes, great. All right, you're in. Drug plan, again, we're going to look at drugs and pharmacy. So this is a super high level kind of conversation. We'll dive into basics and, deeper dive and exactly what your wants and needs are when we have a free consultation. So if you're interested in that, look down below. You'll find the link to the website. When you're on my website, you will see a book now button in numerous places, or you can call 831-423-8542 and get set up for a free consultation. There isn't any charge for the services. We're actually compensated by Blue Cross, Blue Shield, United Healthcare, Humana, whoever it is that we end up working with on your behalf. All right, so kind of put everything I told you in a little box, back corner of your brain somewhere. We're going to talk about world number two. In world number two, I tell the government, I don't want Medicare from you. I want it only from a private company. I want it from Kaiser. I want it from my Sutter Health doctors. I want it from a doctor over here at this other place. And I want it completely private. don't want the government. Now, you still have to pay the government, but if you sign up for a Medicare Advantage plan, they will write a big old fat check to that company that you decided to choose. And they will say, here's some money, take care of my friend John, Mary, whatever your name is. And so now the Medicare card turned off. You don't really have Medicare anymore. You have this thing called Medicare Advantage, or ridiculously called Part C, in my opinion, because the alphabet thing just makes everybody cuckoo. All right, so these are run by private companies. They combine what was in the Part A and the Part B. They have to at least do that. Most of them add a prescription drug plan onto it as well. So it's all in one, kind of like insurance that you have now. So it's more familiar. They are regional, like they work with a network of doctors in your county. And they are usually, you'll see the words HMO or PPO, which means I have to use the doctors in that network in order to get coverage. I only have emergency care outside of my little niche area. And I'll usually have a copay for each service that I use. Some have a deductible, many don't. So it might be $5 to see your primary care and $20 to see a specialist, and $200 if an ambulance picks you up, and $225 a day for up to 4 or 5 days if you go in the hospital. So your out-of-pocket costs as you use it could potentially be higher if you're a high needs person in and out of the hospital, multiple surgeries or ambulance charges. Many of those plans have what they call a maximum out of pocket, which is the maximum I have to pay before you guys start paying 100% of $4,900 to $6,500. Give me just a second. Sorry, had to stop and take that call. You love live trainings, right? All right, so we were talking about Medicare Advantage, completely run by private companies. You no longer have Medicare from the government, even though you're giving them money. And you have to continue paying for that Part B portion, because otherwise your Medicare Advantage plan will not work. They have coverage limits and exclusions that are unique to each plan. So in my area, we have about 20 of these plans right now, and every single one of them are different. List of doctors are different. List of medications are different. In general, a person who's going to be most happy with a Medicare Advantage, they're never going to leave the doctor system that they're in. They're okay with working by referrals. It's the lowest cost typically out of your pocket for premium every month, but potentially higher cost when you actually go to utilize care. But that lower premium is super attractive to them. Also, they're probably not the person who goes and spends 2 or 3 months in another state visiting grandkids or whatever. The people who like Medicare supplement are the ones who want the most robust coverage. They want the biggest doctor pool they can work with. If they get cancer or Parkinson's, they want to be able to go to Stanford or UCSF or the Mayo Clinic or the Parkinson's Institute. So that would be the person who likes that. At 65, the price differential is very close. When I have clients who are 80 and 90, the Medicare supplements are more expensive than the flat rate at Medicare Advantage. And you can always go from the MedSup down to the Medicare Advantage plans. But once you've been on Medicare Advantage for more than 12 months, one time in your lifetime, in that 12-month period, the first time you have it, you can go, not for me. Go back to Medicare, get your supplement and drug plan. After that, you can go back to Medicare and you can get your drug plan. But you're going to have to answer health questions to get a Medicare supplement, and the answer may be no. Usually the people who want to go back are the ones who just got diagnosed with cancer, Parkinson's, something like that. So, that's an issue for them. So that's just a super high level Medicare 101, 2 worlds, Medicare from the government, and the equivalent of some pooper scoopers here that pick over those leftover pieces. I can go anywhere in the US that accepts Medicare and new patients, or turn off the Medicare, keep paying the bill, add to that the premium from your Advantage plan, and have an all-in-one private plan, maybe more similar to something that you have now. So free consultations are available. We can talk about your doctors, your wants, your needs. I work with both types of plans anywhere in the state of California. If you need a referral in another state, a good website is nahu.org, nahu.org. It's the National Association of Health Underwriters, and all of the agents that are going to be listed there will show their specialties. Look for one in your area that lists Medicare and get help there. At least you know you're working with somebody with a code of ethics and maybe some advanced training on that. And, you know, Medicare and health insurance is what they do, not home and auto, and I dabble in this, some other things on the side. So I hope you find that helpful. Again, you can have your free consultation by calling 831-423-8542 or going to our website, lowcostcahealth.com. That's listed up here. Oops, I'm on another website. Never mind. lowcostcahealth.com, and take a look at the Medicare resources. Click on the Book Now button, and I'd be happy to talk to you in the near future. Thanks for hanging in there. You can look below and find some of the links to those resources if you missed it. And I hope to be talking to you all personally soon. Take care.